I'm Dr. Marshall Glesby, an infectious diseases specialist in New York City. We're going to talk about medications. Lifestyle interventions like regular physical activity and healthy eating are important and beneficial for reducing your risks of heart disease. There are times, though, when these interventions aren't enough to reach your wellness goals. Let's talk about medications that people living with HIV may need to consider to get you where you want to be. First, let's review the goals of managing your HIV. You and your doctor can work together and make a plan to help you live a long and healthy life. Your HIV medications can reduce your viral load and increase your T cells, or CD4s, which is one of the most important things you can do to keep yourself healthy. These treatments can mean the difference between life and death, so if you're having trouble staying on your medications, tell your doctor the truth. Do everything you can to take them as directed, even if you experience side effects. However, do keep track of your side effects and report them to your healthcare provider. Together, you can find the best medications with the least amount of side effects. The better you feel, the more likely you are to stay faithful to your regimen.
Living with HIV isn't what I thought it was going to be. First of all, I didn't think I was going to be living with HIV. I didn't think that was an option. There's days when it's difficult because I'm, anchored to that pill box. And, I'll want to stay out, being in a new area. Or, one time I actually was 40 miles out of town and I realized that I'd forgotten my pills and, already late, and there's only one option to go back. So, my whole life is based basically on that. But you get used to it. I mean, I've gotten used to it. I'm comfortable in my body today.
Now let's talk about managing your cardiovascular wellness. Many patients need to treat more than just the HIV. As you work with your healthcare provider, remember that HIV also places you at greater risk for complications of hepatitis, certain cancers, kidney disease, and cardiovascular disease. Our focus here is cardiovascular wellness, so let's run through some types of the medications you and your healthcare provider may consider if your cholesterol, blood pressure, or blood sugars are not at goal. Your doctor will likely have a specific goal in mind for your cholesterol numbers. Ask about the target number and what you can do to help reach your goal with good food choices and physical activity. If your cholesterol levels are still not at your goal, medications can help. Some cholesterol medications help your body lower your LDL, or bad cholesterol. Other medications can help increase the HDL, the good type of cholesterol. That helps keep the LDLs, or bad cholesterol, from damaging your arteries and circulatory system. By reaching your goals, you'll reduce your risk for cardiovascular problems and increase your opportunities to live well. It's also common to have higher than normal triglyceride levels, which is a type of fat found in your bloodstream. High triglycerides can often be managed with lifestyle changes such as healthy eating, regular exercise, and reducing alcohol consumption. But sometimes people still need to be treated with medications to bring the triglycerides into an acceptable range. Your healthcare provider will also have a treatment goal for your blood pressure. Ask about it and work to get there. Often reducing salt intake and increasing exercise are the first steps. If your blood pressure is still high, your healthcare provider may want you to consider a diuretic, a beta blocker, an ACE inhibitor, an angiotensin receptor blocker, or maybe a calcium channel blocker. Each of these types of medications offer different paths to reduce blood pressure, which can help keep your arteries flexible and in good shape. Cholesterol is less able to get lodged into the lining of flexible, healthy arteries. Blood sugar management will also have a goal number, and if the sugars are too high, it may warrant food and exercise changes, or possibly a medication. Again, find out your goals and discover the action steps you can take to reach them. In addition, many patients find that a medication is helpful as they quit smoking. There are some medications that do not work well together, and your healthcare provider will work with you to determine a good combination that meets your needs and goals. Remember to report everything that you're taking and any symptoms that you're experiencing. Keep in mind, if you're taking over-the-counter supplements for any reason, these can influence the effectiveness of your treatments. Your healthcare provider needs to be informed if you're taking additional vitamins, supplements, or alternative treatment methods. Some of these may not blend well with your medications. And what about those who prefer to take as few pills as possible? That's a great plan as long as you're reaching your target goals. The wellness goals are most important. Some patients are able to use cholesterol or blood pressure medications temporarily while they learn new habits for healthy living. Good nutrition, physical activity, maintaining a healthy weight are all extremely important and beneficial. The more you invest in good health, the more likely it is that you'll need fewer medications or that lower doses will provide the boost you need for living well and reaching your goals.